Welcome to another ECG video. Before we start, have a look at this ECG and try to figure out your diagnosis based upon ECG findings. Alright, this is an ECG of a patient with arrhythmogenic right ventricular dysplasia, also known as ARVD. ARVD is an autosomal dominant genetic disorder of myocardium in which there is fatty infiltration of the right ventricular free wall, predisposing to paroxysmal ventricular arrhythmias, sudden cardiac death, and biventricular failure. It is the second most common cause of sudden cardiac death in young people after hypertrophic cardiomyopathy, accounting for up to 10% of sudden cardiac deaths in patients less than 65 years of age. It has a prevalence of approximately 1 in 5,000. Diagnosis is difficult and relies on a combination of clinical, ECG, and radiological features as defined by the 2010 Task Force criteria. ECG features are T-wave inversion in right precordial leads V1 to 3 in the no absence of RBBB and is seen in 85% of patients. Second feature is epsilon wave, which is the most specific finding, seen in 50% of patients. There is localized QRS widening in V1 to 3, which is greater than more than 110 milliseconds. Also, there is prolonged S-wave upstroke of 55 milliseconds in V1 to 3. There could be ventricular ectopy of LBBB morphology with frequent PVCs greater than 1,000 per 24 hours, and paroxysmal episodes of ventricular tachycardia with LBBB morphology.